Hello, let's talk about posterior triangle of the neck. So this you can see this is the muscle which divided the neck into two triangles, interiorly the anterior triangle and posteriorly the posterior triangle. Okay, this muscle is sternocleidomastoid, uh, which originate from the mastoid process and insert on the sternum and clavicle. Okay, so it insert on sternum. So this is sternal and head, and this head insert on the clavicle, so it is clavicular head. Okay, so the this muscle sternocleidomastoid divide the neck into two triangles, interior triangle and posterior triangle on each side. Okay, so let's talk about the posterior triangle. So regarding the posterior triangle, first we will discuss about the boundaries of the posterior triangle. So the interior boundary is formed by the posterior border of the sternocleidomastoid. Okay, so this is the interior border which is formed by the posterior border of the sternocleidomastoid, while the posterior boundary is the trapezius muscle, the interior border of the trapezius muscle. So the interior border is sternocleidomastoid interior head, while the posterior border of the posterior triangle is the interior border of the sternocleidomastoid. The apex is formed by the meeting of these two muscles. Okay, this is the apex, while the base is formed by the middle third of the clavicle. Okay, the medial end of the clavicle is the muscle which is inserted is sternocleidomastoid, while the lateral head is inserted by this muscle which is trapezius muscle. Okay, so the base is formed by the middle third of the clavicle. So this is the posterior triangle boundaries. Its floor is formed by these muscles. Okay, so from above downward, this muscle is splenius capitis muscle, this muscle is levator scapulae muscle, this muscle is scalenus posterior, this is scalenus medius, and this muscle is scalenus interior. Okay, how we will identify the scalenus interior and medius muscle? The scalenus interior and medius, in between these two muscle, the roots and trunks of the brachial plexus is passed. Okay, so in between the scalenus interior and medius, the brachial plexus, the roots and trunks of the brachial plexus is present. Now the posterior, the roof of the posterior triangle is formed by the skin, superficial fascia and deep fascia. Okay, investing layer of deep fascia, the skin, superficial fascia and investing layer of deep fascia. The superficial fascia of the posterior triangle has cutaneous nerves branches from the cervical plexus. Okay, cutaneous branches of the cervical plexus, external jugular vein and the muscle which is platysma. Okay, so the platysma muscle is located in the superficial fascia of the posterior triangle. Okay, so you can see this is sternocleidomastoid muscle, this is trapezius muscle, and the triangle which is made by these two muscle is posterior triangle. The base is formed by the middle third of the clavicle. So this is superficial fascia which contain external jugular vein. This is external jugular vein which pierces the deep fascia. Okay, which pierces the deep fascia. These nerves are cutaneous branches from the cervical plexus. So this is transverse cervical nerves, branches from the transverse cervical nerves. This nerve is greater auricular nerve, which is also come from the cervical plexus, and these nerves are branches from the supraclavicular nerve. Okay, supraclavicular nerve. These all nerves pierces the deep fascia. It travels through the posterior triangle, and then it pierces the deep fascia to come into the superficial fascia. Okay, so the floor is formed by muscles, while the roof is formed by the skin. This is skin, then the superficial fascia, and then the deep fascia, investing layer of deep fascia. Okay, so this is all about the boundaries of the posterior triangle. You can also see in this image, this is sternocleidomastoid, this is trapezius. Okay, so the interior border of the posterior triangle is formed by this sternocleidomastoid. Then the base is formed by the middle third of clavicle. The posterior boundary is formed by the sternocleidomastoid, and the apex is formed by the meeting of these two muscles. Okay, so this is the posterior triangle of the neck. While this muscle which is present in the posterior triangle of the neck is inferior belly of omohyoid muscle, which divide the posterior triangle into two triangles or two division. This upper triangle, which is big one, this is occipital triangle, while the lower one is smaller one. This is called supraclavicular triangle or subclavian triangle. Okay, so these are the boundaries. While this is the some of the floor muscle, which is, this one is scalenus medius, and this one is scalenus posterior. Okay, the scalenus interior is not shown here. Okay, so this is the posterior triangle of the neck, bounded interiorly by the posterior border of the sternocleidomastoid, posteriorly bounded by the trapezius muscle interior border. The apex is formed by the meeting points of these two muscles, while the base is formed by the middle third of the clavicle. The roof, the floor is formed by these muscles, levator splenius capitis, levator scapulae, scalenus posterior, scalenus medius, and scalenus interior. While this muscle divide the posterior triangle into occipital triangle above and the supraclavicular or subclavian triangle below. Now we will discuss about the contents of the this posterior triangle. So you can see this is the sternocleidomastoid, which divide the neck into interior triangle and posterior triangle. This one is posterior triangle. Posterior triangle is bounded posteriorly by this trapezius muscle. Okay, now the uh, contents of the posterior triangle, it contains three arteries. Okay, so the arteries which are present in the three arteries which are present in the posterior triangle is this one. Okay, so now if we remove this sternocleidomastoid, so we can better look into the contents of the posterior triangle. Okay, so this is the cut end of the sternocleidomastoid, this is the lower cut end of the sternocleidomastoid. So you can see the three arteries clearly. This one is transverse cervical artery, which comes from this artery. This is thyrocervical trunk, okay, which originates from the first part of the subclavian artery. Okay, so this is subclavian artery, its branch is thyrocervical trunk. So this artery is transverse cervical artery, which is present in the posterior triangle of the neck. interior to which muscle? Interior to this muscle, which is scalenus interior. Okay, so this scalenus interior, this is scalenus anterior, this is scalenus medius, okay, and this is scalenus posterior. Okay, so the first artery, the three arteries are present in the posterior. The first artery comes from the thyrocervical trunk of the subclavian artery. This is transverse cervical artery. The second artery is this one, which is just above the clavicle. This is suprascapular artery. Suprascapular artery. Okay, this one is suprascapular or supraclavicular artery. It is also called supraclavicular artery. Okay, as it is above the wait. Okay, so this is suprascapular artery. Now the third artery which is present in the posterior triangle is this large artery, which is subclavian artery. Now, as I mentioned, this is subclavian artery. Okay, subclavian artery. Sorry, this muscle is scalenus anterior muscle, and this scalenus anterior muscle divide the subclavian artery into three parts. First is proximal to the scalenus anterior. This is the first part. Behind the scalenus anterior is the second part of the subclavian artery, while below are dorsal or distal, sorry, distal to the scalenus anterior is the third part of the subclavian artery. So the third part of the subclavian artery is located in the posterior triangle of the neck. Okay, subclavian artery runs behind the scalenus anterior muscle, while the transverse cervical artery and the suprascapular artery runs anteriorly to the scalenus anterior muscle. Okay, so these are the three arteries which are present in the posterior triangle. Now, one vein also present in the subclavian triangle, and this vein is this one. This is external jugular vein. Okay, so external jugular vein are also present. Now the nerves which are present in the posterior triangle, we will talk about it. First, the cervical plexus. So this is the cervical plexus, which is present interior to this muscle, which is scalenus medius. Okay, so the cervical plexus and its branches are located in the posterior triangle of the neck. Okay, the other nerve which is very important is this nerve. Okay, this nerve is present, also present in the posterior triangle. And how we will know it, that this is the spinal accessory nerve. Okay, so this nerve is spinal accessory nerve. Okay, cranial nerve number 11. We will know it, how we will know it, that this is spinal accessory nerves. So the spinal accessory nerve run interiorly to the this muscle, which is levator scapulae muscle. Okay, so this is levator scapulae muscle, and the muscle which runs interiorly to it is spinal accessory nerve. So it is one of the content of the posterior triangle. So cervical plexus and its branches, spinal accessory nerve, and this plexus, which is brachial plexus, also located in the posterior triangle in between the scalenus anterior muscle and the scalenus medius muscle. Okay, so this is scalenus medius and this is scalenus anterior, and in between these the brachial plexus runs in between it. Okay, the roots and trunk spatially. Okay, so the nerves which are present in the posterior triangle are brachial plexus, okay, in between the scalenus anterior and medius, the spinal accessory nerve interior to the levator scapulae muscle, okay, and the cervical plexus and its branches. Okay, so you can see that these are the nerves. Okay, now this these nerves which are cutaneous branches of the cervical plexus. This is greater auricular nerve and this is lesser occipital nerve. Okay, you can see the other nerves. This nerve is transverse cervical nerve, which also comes from the cervical plexus, which is located in the posterior triangle. This nerve is supraclavicular nerve. Okay, this is supraclavicular artery, yeah, or suprascapular artery. Okay, this nerve which is present interior to the levator scapulae muscle. This is levator scapulae muscle. This is spinal accessory nerves. This is greater auricular nerve, which also comes from the cervical plexus. This is the lesser occipital nerve, and this one is greater occipital nerve. Okay, so these are the contents of the brachial posterior triangle of the neck. Now this is the cervical plexus, which is present in the posterior triangle. It is just located interiorly to the this muscle which we just look. This is scalenus medius, and in front of scalenus medius is the cervical plexus. And cervical plexus is formed by the ventral rami of C1, C2, C3 and C4. First four cervical nerve form the cervical plexus. Cervical plexus and four cutaneous branches originate from it. Supraclavicular nerve, transverse cervical nerve, greater auricular nerve and lesser occipital nerve. It also gives muscular branches this is ansa cervicalis, which is the muscular branch of the cervical plexus. It has superior root and inferior root, and it gives muscle to the muscle infrahyoid muscle group. Okay, so this is the cervical plexus. Cervical plexus also give branches to the phrenic nerve. Okay, phrenic nerve is formed by C3, C4 and C5 cervical nerves, and the cervical plexus has greater contribution in the formation of the phrenic nerve. Okay, so now this is the posterior triangle. Okay, this muscle which is present, which is shown here, is scalenus interior muscle. Now we will look at the structure which is just interior to the scalenus interior. We already talked about it, but let's revise. So this is transverse cervical artery. Okay, this is suprascapular artery, which comes from the thyrocervical trunk of the subclavian arteries. This is thyrocervical trunks originate from the first part of the subclavian artery, and this artery is transverse cervical artery, which is interior to the scalenus interior muscle. This is suprascapular artery. It is also interior to the scalenus interior muscle. Okay, and this vein which is present interiorly is the subclavian vein. Okay, this is subclavian vein, and this vein is internal jugular vein. Okay, so the internal jugular vein, subclavian vein, transverse cervical artery, suprascapular artery is present located interior to the scalenus interior muscle. Okay, now the nerves which are present interiorly to the scalenus interior is this nerve, which is phrenic nerve, and this nerve, which is vagus nerve. So the two nerves is related interiorly to the scalenus interior muscle. This is phrenic nerve and this one is vagus nerve. Okay, now the structure which is posterior to the scalenus interior muscle is subclavian artery. This is subclavian artery first part. The second part is posterior to the scalenus interior muscle, and the third part is this one, which is distal to the scalenus interior muscle, while this muscle is scalenus medius. Okay, and these are the branches from the are roots and trunks of the brachial plexus. Okay, so this muscle is scalenus medius, and in between scalenus medius and scalenus interior is roots of and trunks of the brachial plexus. Okay, so the structure which is posterior to the Scalenus interior, but interior to the scalenus medius is brachial plexus, subclavian artery. Okay, so this is the posterior structures of the scalenus interior. Okay, so this is all about the posterior triangle of neck. We have covered the boundaries, the contents of the so posterior triangle and the cervical plexus. Thank you.